how can we best give our brain injury survivors support in that part of their recovery?
So I think, I mean, you touched on, there was a word that you used earlier, which is hope. And I think one of the things that we need to give our patients is hope. And I think, you know, essentially what we want to do for all of them, not just for the unseen symptoms, but for the problems with movement and the problems with communication, is we really want patients to be able to access the physical, the psychological, and the emotional support and treatment that they need to continue recovering for as long as possible. And so that's tough, right? Because that's not what we do at the moment. So there's probably a couple of areas that I think, you know, we need to focus on in order to push the field forward. And the first is really a kind of refocusing of attention onto emotional and psychological support. I think it's something that we don't do, and I think people in the field are starting to realize that it's something that we need to be able to provide services for. So it's not that it's a difficult thing to do. It's really a matter of resources. There are healthcare professionals right the way through, you know, neuropsychologists, speech and language therapists, occupational therapists, physiotherapists, and even sometimes doctors who kind of get this problem and would know what to do if they had the resources to manage it. So that, but recognizing it is the first thing. You have to know it's there. You have to ask the right questions, and you have to have the resources to then provide the support. So it's not just about providing top-down support. This is not about the healthcare profession giving the treatment to the individual. It's sometimes about creating the environment to allow people to find their own solutions, because it's not always going to come from the doctors.
Right. And have you seen, can you see the difference? Can you see what happens when you have patients who are honest about the invisible symptoms of brain injury and how that affects someone's overall recovery? Is that something that you notice?
Yeah, it's relief. You know, relief that it's been identified, and that they're not the only people to experience it. I would imagine that that's sometimes another feeling that, well, why am I so fatigued after stroke? This shouldn't be happening. But yeah, to realize that there are many other people experiencing it, I would imagine provides some kind of relief and the beginning of being able to then go and access the help that's required.